What's up, guys? Tim Halstead, the Grumpy PA. It's kind of a strange name for a YouTube channel, especially for physician assistants or other medical providers that want to learn about medicine and find out the ins and outs. But the reason I named this channel that is because that's what I'm kind of called as a nickname. It's not something that I made up. It's people I've worked with, including PA students and doctors and nurses. So I'll give you a little update or insight of where I'm coming from. I've been a PA for 25 years. Helped initiate a PA program at LeMoyne College in Syracuse, New York with my biology professor started around 96, but I was in the class in 98. And back then it was a 2-year program and you got a certificate. Nowadays, as you know, it's a master's program and I don't even know if it's going to go to a doctorate program. But the reason I'm called the Grumpy PA is because I don't tolerate BS. And that's the bottom line. It's not because I'm mean to people, I'm not nasty to people, quite the contrary. But what I do emphasize on is getting work done. I've been working in emergency medicine now for 10 years. And you guys that are in emergency medicine kind of understand the situation that there isn't a lot of time for fooling around. You know, cell phones are the rage now. Back when I started, phones were just coming out. I remember I worked in orthopedics for a couple years and started orthopedic practice. We'd got the first cell phones, the StarTAC, Motorola StarTAC, and I worked for a practice that's now called Victory Sports Medicine. It was called that before. And I'll get into that history at another time. I've also done cardiothoracic surgery for 13 years. A lot of experience with endoscopic vein harvesting, open vein harvesting, VAS procedures, treatment for AFib. Again, a whole nother topic. And now emergency medicine for the last 10 years. So in that period of time of 25 years of being a PA, I've seen a lot of technology come. And cell phones are big, especially in hospitals, and it's probably true in any business. And it gets to the point where people want to get on those phones and check Facebook or whatever social media they're into, and it takes away from patient care. And that's an issue there that I have. Just for an example, let's say you're in an ER and just use, 10 patients in a day, right? If you spend 5 minutes waiting for a urine or some other lab or an IV or whatever it is, 5 minutes a patient, that's 50 minutes. So that's almost an hour right there. So now what? Now you see 20 patients. Now you got 2 hours of wasted time. And that's what really pisses me off, because we're in such a rush in medicine. If you're a PA student, doctor, nurse practitioner, whatever it is, you'll see what I mean or know what I mean. So that's why I'm called the Grumpy PA. Also, I'm old school, okay? I don't wear a white lab coat, never wore a lab coat, don't care for that kind of thing. I don't carry my stethoscope around my neck and walk around. I may carry it on my shoulder here and there, but I'm just not a typical healthcare provider, we'll say. And I may say this, I'm gonna say it, and it might not be agreeable to some of you guys that are newer PAs, but you know what? I don't care for the physician associate title. I'm not into any of that. It's been a physician assistant since it was started at Duke University back in 1970, around that area. I don't know the whole history, you guys can comment on that. And that's what it is to me, physician assistant, not physician associate. And I will say my daughters, who are 7 and 11, call me a physicianal assistant. That's okay. But I'm not into the political correctness type stuff. That's just me. I don't think you have to treat anybody separately with respect. Everyone should be treated with respect. Everybody deserves to be listened to. So I'm just old school and I say it how it is. So this channel, what it's gonna do is, I'm not here to teach you medicine. If you're watching this, you should already know about medicine. But what I wanna teach you are the finer points of medicine. How to have great Press-Ganey scores. How to deal with the MIPS, all the Medicare rules. How to deal with patient conflict. How to avoid lawsuits. All the tricks of the trade that people don't know. And I'm thinking about starting the membership for this once I get a few subscribers, and not a consult where I'm a headhunter. I don't want to be that guy. But what I want to be is the guy that guides you and can give you advice on getting a job or a particular practice, since I have a lot of experience with some of the things or specialties that a lot of people don't know about, especially cardiothoracic surgery. especially being a new student or a PA that's thinking about going into that. Because I can tell you what I'm going to focus on are things that you've never even seen, such as I've been involved with the great side of being a physician assistant, teaching and helping people and all the great stuff, but I've also been involved with the bad side, stuff that you don't want to get involved with, that I happen to be involved with by association or by my own wrongdoing. And I'm going to get into that. I'm going to tell you stories that stuff you can't even believe, and I have to think about how I do this because I don't want to get sued for this, medical legal aspects. But I've seen physicians who murder their wives. I've seen doctors die from drug addiction. I've seen doctors get busted for drug addiction, alcohol addiction. I've seen embezzlement in practices. I've seen thieves. I've seen Medicare fraud. I've seen every gambit that you can think of. And I'm here to talk about it and tell my story and give you experience. Because all the PA channels that I see, they're great out there. A lot of young guys and girls talking about, oh, it's great being a PA and this is what you can expect and this and that. You know, I can tell you that too. But I'm going to tell you stuff you've never even heard before. Stuff that's not talked about. And like I said, I have to figure out how I can say that because I don't want to incriminate people. Although they've already been incriminated. So this channel is not just going to be about learning about how to be a physician assistant or about EKGs or about cardiac ischemia or PEs, but it's going to be about every aspect of being a healthcare provider, whether it's a doctor, PA, nurse practitioner, or probably even a nurse. Now, I also have a YouTube channel called Drag Boss Garage, and I'll put the link on this channel. You might want to look at that because I have some information there about differential diagnosis on back pain, which it's gonna be on this YouTube channel also. But one of the big things I have on that channel are a lot of live chats with a lot of famous racers. And you may look at this area here, and this is my garage, Drag Boss Garage. Because before I was a PA, I was a mechanic. And I worked on cars and transmissions and did all that at night. Actually, I did it as a living before I had an opportunity to go to school. And I'll get onto that with probably the next 1 or 2 videos. But I've always had a love for cars and engines and drag racing. So that's why I'm in here. And that's what you see here. So that channel's growing fast. I think I have over 15,000 subscribers. But I didn't want to put PA stuff, medical stuff, on a channel that's more racing involved. So I invited all those guys to come to this channel, and they may be here with some of the comments you may read that show these guys don't know anything about medicine. And they don't. And they're here to learn. And that's what I want to tell you. One of my themes on my Drag Boss Garage is you're always learning something. And that's what I want you to take away from this YouTube channel, is that you're always learning something. Every time you come here, I want you to learn something. Like I said before, one of the biggest things I have are live chats. And that's what I want to start featuring on here. I already have a whole guest list, we'll say, of surgeons, physicians, other PAs, possibly some nurse practitioners, other healthcare providers, including CT technologists, ultrasound, the whole gambit of medicine. We're going to bring them in and do live chats and answer questions on what you may have. Because as a PA, especially starting out, there's a lot of things you're not sure what you should order and what you shouldn't order. Because what's happening now, I see the trend, is just to order. Just shoot a shotgun and order every lab test you can. Order every CT scan because you don't want to miss anything, because the liability of getting sued is high. So I'm trying to teach you how to avoid that. The keys to history and physical. And those are key words, history and physical. Don't forget them. If you know your physical exam, you can avoid ordering extra tests. So hopefully this comes across well, and I can start building a following, and we can start learning medicine together and teaching you things that you've never heard or seen before. So stay tuned to the Grumpy PA. Thank you to my family, my wife, Andrea, my daughter Isabella and Elena, and our dog Zeus.